Hi, everyone, and welcome to Clerkship Ready Pediatrics, a podcast aimed at helping you excel during your clinical clerkship in pediatrics. I am Erica Licari, and I'm a pediatric resident at the University of Virginia and am planning to pursue a fellowship in allergy and immunology. Because of that, I thought it would be very fitting to talk about something that comes up time and time again in the pediatric clinic: how to introduce complementary foods and potentially allergic foods into an infant's diet. This will be something parents will ask you many questions about, and they will often want to know when to introduce pureed and solid foods, how to introduce these foods, in which order should they be offering these foods, and everything in between. So what do we mean when we say complementary foods? Complementary foods is a catch-all category by which it's just defined as all solid and liquid foods other than breast milk or infant formula, whereas potentially allergic foods are things like eggs, peanut butters, nut butters, fish, shellfish, etc. We use the terms complementary foods and solid foods pretty interchangeably, so I will be bouncing between these two terms during the podcast. So, for a lot of parents, introducing new foods into their baby's diet can be a scary feat, especially if this is their first child or if the parents have had experiences with food allergies in the past. There's also a lot of misinformation on the internet right now about very specific ways that parents should be introducing foods and very strict guidelines that they should follow. So sometimes parents can be a little bit overwhelmed and worried that they're going to make a mistake when introducing these foods. It's important to keep this in mind when you're counseling them, because at the end of the day, introducing these foods does not need to be as complicated or scary as sometimes it could be made out to be online. As a general rule of thumb, the first time that we will start recommending the introduction of solid foods in the form of a puree is around the time an infant turns 4 to 6 months old. And that is only if the infant is able to demonstrate adequate head control when we are assessing them at our 4-month-old well-child visit. So why this age? When thinking about both the organ development and the development of feeding skills, it's important to know that an infant's renal and gastrointestinal systems can only start to metabolize complementary foods around the age of 4 months. Additionally, the infant will usually develop motor and dental skills to sufficiently chew and swallow foods around 6 months. There have also been some studies that showed that very early introduction of complementary foods, such as too early, so before 4 months, can be associated with harmful health side effects. For example, there's a study that came out in 2011 that found the introduction of solids in formula-fed babies before the age of 4 months was actually associated with a 6-fold increase in the risk of obesity of these children by age 3. However, they didn't find this increased risk when they looked at very early introduction of these solids in breastfed babies. But again, this is just something to keep in mind. So, why is it important to introduce complementary foods into an infant's diet? And there are 2 main reasons that I want to highlight here. The first is that breast milk and infant formula do not contain all of the nutrients a growing infant will need to continue growing and developing appropriately. This is specifically true once the child turns 6 months old. For example, one of the most common deficiencies that we see in children and in infants is iron deficiency, which is something we'll touch more on as we get further through this podcast. There's also a great episode specifically talking about iron deficiency anemia in this podcast series. It's episode 27, if you guys want to check that out too. The second reason that it's important to introduce these foods early into an infant's diet is based on a very large pediatric study called the LEAP study that was published in 2015. So in 2015, they performed a randomized control trial published into the New England Journal of Medicine that looked at the prevalence of peanut allergy in a cohort of atopic children. As a reminder, atopic just means people who are prone to allergic conditions. So this could be people with seasonal allergies, asthma, food allergies, eczema. And so this study included infants between the age of 4 months to 11 months that had a history of severe eczema, egg allergy, or both. And then these infants were randomly assigned to consume or avoid peanuts until the age of 60 months, or 5 years old. At the end of the study, the prevalence of peanut allergy in the group of children that avoided peanuts was 13.7%, whereas the prevalence of peanut allergy in the groups that consumed peanuts was only 1.9%. Because of these findings, this study had huge implications regarding the introduction of potentially highly allergic foods into infants' diets. More specifically, the findings from the study led to the recommendation that infants should be introduced to high allergen foods as early as possible, starting at age 4 months, in order to reduce the risk of developing a food allergy to these foods. And although the study focused solely on peanut-specific allergy, we have applied these findings to all other allergenic foods, such as egg, soy, shellfish, etc. So getting back to the main topic of today's discussion, what do you do when the 4-month-old child comes into your office with adequate head control and you want to discuss incorporating solid foods into their diet? How do you counsel parents on how to start introducing these foods? I personally like to go about this by thinking about introducing foods into 2 different frameworks. The first is the introduction of complementary foods, and the second is the introduction of potentially allergenic foods. So in terms of the introduction of complementary foods, both the AAP and the WHO recommend first offering a variety of single ingredient foods such as pureed vegetables, fruits, grains, and meats. And these can be given in any order that the parents desire. It can be a safe bet to start with something like an iron-fortified cereal. So full-term infants are born with iron stores that eventually become depleted by about 4 to 6 months of age. Formulas, fortunately, contain a small amount of iron that can help make up for this. However, it's important for infants to receive additional sources of iron through foods that they eat. Moreover, this is extremely important in breastfed infants since breast milk contains a very, very small amount of iron. Because of this, recent pediatric guidelines have started recommending the supplementation of breastfed or partially breastfed infants with a pediatric multivitamin that contains iron at age 4 months in order to help with the proper acquisition of iron. So this is important to keep in mind because encouraging parents to provide their infants with an iron-fortified cereal helps you increase both the baby's iron stores while also encouraging the start of adding in complementary foods. We recommend mixing the infant cereal with formula or breast milk in a bowl to the point that it's soupy in consistency, and then feeding the baby it with a spoon. It's important not to directly mix these cereals into the baby's bottle and then subsequently make the nipple size bigger to help with the flow of the formula mixed with the cereal, because this can actually be a big choking hazard. So again, we recommend when parents start using these iron-fortified cereals to mix it with a little bit of breast milk or formula in a bowl and then feed the baby it. Other things to keep in mind when talking with parents about introducing these complementary foods is that many parents will ask if they should introduce 1 new food per day. And while there's no strict guideline with this, we generally recommend only providing 1 to 2 new foods per day in case the child has an adverse reaction. So this can help to narrow down the possibilities of what could have caused that adverse reaction. Additionally, many parents will ask if they need to wait a few days in a row before offering their child a new food. For example, a trend that I've seen is that many parents will provide their infant with pureed peaches for 3 days in a row and then move on to pureed squash for 3 days in a row. This is not something that needs to be followed. Again, parents can introduce foods into their infant's diet in any order that they choose and in any time manner that they desire as well. They do not need to be waiting a certain amount of days in between offering a new food. However, going back to what we just talked about, we generally recommend only offering 1 to 2 new foods per day in case that baby has an adverse reaction. It is also important to remember that the main calorie source for these infants should still be coming from their formula or breast milk, and that the introduction of these foods into their diet can be seen as an added bonus rather than taking the place of one of their bottles or breastfeeding occurrences. Because of this, we recommend providing infants with just a few teaspoons of each of these purees per day. They do not need to eat a full serving or an entire container of these purees. And lastly, important foods to avoid include honey, due to the risk of botulism in babies less than 1 year old, cow's milk, because we transition to cow's milk instead of formula or breastfeeding at age 12 months, but not prior. And this is because cow's milk has a low absorbable iron content, which can lead to iron deficiency anemia, and it doesn't have all of the nutritional value that an infant needs from either breast milk or formula. We also advise to avoid foods that can be choking hazards, such as whole nuts, grapes, popcorn, etc. And we also always recommend first providing foods with a very smooth or soupy texture and then starting to advance the texture of the food as the child continues to grow and get comfortable with eating complementary foods. Now, in terms of the introduction of potentially allergenic foods, like we mentioned before, the LEAP study that was published in 2015 had a major impact on the recommendations regarding introduction of potentially allergenic foods. Prior to 2015, the recommendation was to delay the introduction of these foods, especially in high-risk children, aka children with other atopic conditions. For example, it had previously been recommended to wait to introduce cow's milk until age 1, eggs until age 2, and seafoods, peanuts, tree nuts until age 3. However, based on the results of the LEAP study, these recommendations have completely changed. Now the recommendation is to introduce these foods as early as possible, aka as early as 4 months, in order to reduce the risk of the development of possible food allergies in these babies. In terms of the most common allergenic foods, the list usually consists of milk, egg, soy, wheat, fish, shellfish, tree nuts, sesame, with egg and milk being actually the two most common in young children. In terms of introducing these foods, it is recommended that these foods start to be added into the infant's diet after the infant has tried and tolerated a few of the non-allergenic complementary foods. This is just to make sure that the infant can tolerate non-allergenic foods and is doing well with swallowing and handling the texture of these complementary foods. For children with a history of atopy or a family history of atopy, it is recommended to start with a small serving of each of these foods and then gradually increase the serving size as it's tolerated. In terms of cow's milk, we still recommend avoiding just plain cow's milk in a bottle, but instead we can introduce other cow's milk-based products such as yogurts and cheese. When counseling parents on the introduction of these foods, it is important to review with them what a true allergic reaction will look like. For example, it is helpful to describe what a hive may look like. This is important because many acidic fruits can actually cause a contact dermatitis like rash on the patient's skin, and many parents will worry that this is an allergic reaction. Remember that a hive will usually be described as an erythematous raised area with a pale or whitish center that comes and goes on many different areas of the patient's body, whereas a rash that is from contact dermatitis is usually an erythematous flat area that may have papules, and it usually just stays in one spot. With this in mind, it is important that you clarify with the family what a hive would look like versus what a contact rash would look like. Otherwise, parents can unfortunately get stuck down a rabbit hole where they start avoiding or eliminating certain foods from the child's diet due to unclear reactions that their child had, when in reality, many of these reactions may not have been allergic or IgE-driven reactions at all. Another reason why this is incredibly important to bring up is that avoiding a food that was previously tolerated can sometimes lead to the formation of a food allergy. This is a specific title called FAPTF, aka food allergy to a previously tolerated food. Because of this, we want to make sure that parents do not start avoiding or eliminating foods from their infant's diet due to confusion as to what type of skin reaction the patient actually had. And as a side note related to this, many parents with children that have very bad eczema will sometimes come to the office reporting that their child's eczema has been exacerbated by XYZ food. And because of this, they will start eliminating that food from their child's diet in an effort to help with their eczema. Again, we do not want this to occur because as we just talked about, if you avoid a certain food, you can sometimes be at a greater risk for then developing an allergy to that food. Lastly, I wanted to touch on another common issue that arises once these complementary and allergenic foods are introduced to the infant's diet, and that is that bowel habits change. It is very, very common for parents to talk about how their baby stools have started to change in consistency and or frequency after they implemented solid foods into their diet. Specifically, many parents will note that their baby started stooling less frequently or their stools appear to be slightly harder after they introduced these foods. And in many cases, this change in stool may be directly associated with the types of purees that the parents are providing their babies with. For example, foods with bananas or rice cereals can have a tendency to constipate babies, whereas other foods can soften stools or increase the frequency of stools. And these are well known as the P foods, so prunes, pears, peaches, apricots, and apples. This is important to keep in mind, and I usually like to provide anticipatory guidance for families when I discuss implementing complementary foods, just so that they know that it is expected to see changes in their baby stooling patterns after doing so. So in summary, here are the 3 big takeaways that I want you to remember from this podcast, if nothing else. Number 1, we can first start introducing complementary foods into an infant's diet around 4 months of age, as long as the infant demonstrates adequate head control in our office and they don't otherwise have any medical conditions that would interfere with their ability to safely swallow purees. Number 2, parents should start by offering a variety of single ingredient foods with iron fortified baby cereal as a great first option, since the baby's iron stores that they are born with will generally be depleted by age 4 to 6 months. And number 3, in terms of introducing potentially allergenic foods, it is important to introduce them as early as possible in order to decrease the risk of the potential development of a food allergy down the road, and to also make sure that you provide parents with guidance as to what a true allergic reaction would look like so they don't start avoiding or eliminating foods from the infant's diet prematurely. Thank you all so much for listening to Clerkship Ready Pediatrics. I hope you found today's episode helpful, and don't forget to subscribe below and rate the podcast.